Hello friends, welcome to the healthcare today. Today we are going to speak about lung cancer. If you see over the last few years, we are seeing rising number of cancer cases. As we know, the most common cancer which we encounter is breast cancer. But once you combine both the male and female sexes, the most common cancer which we see is lung cancer. And lung cancer is a very aggressive variant which leads to significant death as well as mortality rate. Now once you speak about lung cancer, what makes it so difficult? Because right from the diagnosis, lung cancer has some very non-specific symptoms. So most of your lung cancer symptoms might mimic tuberculosis as well. So what are the most common symptoms which we see in lung cancer? Any unexplainable cough, any chest pain, or any cases where there might be coughing out of blood, which is called hemoptysis, or cases where you can see there is accumulation of fluid in the lungs. Then that is the time you need to evaluate these patients. As you can see in the picture, this is the windpipe and this is the lungs. This is the right lung, this is the left lung, and this is the heart in between. Now if your tumor is in the periphery, for example if the tumor is at the outside edge of the lung, then the symptoms might be very minimal. What you can experience is a mild pain while taking deep breath. So unless it grows to such a level and it gets involved with an airway, then you don't feel any symptoms. But if the lung cancer is central, which we also call central tumors or airway tumors, then the symptoms are more pronounced. You might have cough, you might have wheezing because of the obstruction in the airway, or you might have coughing out of blood because of the aggressive tumor growth and involving the mucosa. So once the tumor is in the center, the chance of picking up lung cancer is earlier. If it is in the periphery, the chance of picking up is very less. Now, if the tumor is central, the approach is very simple. All the lung cancers or all the tumors which are inside the lung should be biopsied. There is a common misnomer in the society that once a patient is subjected for biopsy, that the lung cancer might spread. No, it is not true, because the biopsy techniques are very simple. The needle precisely goes inside the tumor and collects the sample from the tumor. Even from the peripheral tumors also a CT guided biopsy is done, which is absolutely very safe. And this common misnomer of spreading of cancer because of biopsy is unfounded. Now once we speak about lung cancer, as I told you, symptoms are very vague. So once you are having these symptoms, what should you do? So once you are having these symptoms, you should meet a pulmonologist. So most common investigation which we do is an X-ray followed by a CT scan and a PET scan, which we commonly call as imaging. Now we know that chest X-ray will give you only 50 to 60% of the information. CT scan gives you complete information about both the lungs. But as we all know, cancers do metastasize. The most common metastasis of lung cancer is usually seen in brain and sometimes in a gland called adrenal gland, which is above the kidney. So you do a PET scan to see whether there is any extra pulmonary metastasis. So the imaging includes X-ray, CT scan as well as PET scan. Now once we know that there is a tumor inside the lung, so what is the next logical step? You need to do a biopsy. Many times patients ask us that that it is a tumor, that it is a lung cancer suspected, why do you want to do a biopsy? Because CT scan is saying. Because biopsy tells you multiple informations. Now as I told you, lung cancer symptoms are similar to tuberculosis. So once you get a biopsy, it is very clear whether it is cancer or not. So the alternative diagnoses like tuberculosis are ruled out. Now once you get a biopsy, it is easy to see which type of lung cancer it is. Coming to types of lung cancer, there are two types of lung cancer broadly. One is non-small cell carcinoma, one is small cell carcinoma. So 80 to 85% of lung cancers are non-small cell carcinomas and around 10 to 15% cases are small cell carcinomas. Small cell carcinomas are very aggressive. That's why they respond to chemotherapy and radiotherapy easily. So they are very aggressive, they are rapidly dividing tumors. So how do we define aggression in tumors? We categorize by doubling time. For example, if the tumor is around 50 ml, how much time it takes to become 100 ml? So you measure the volume. So in small cell cancers, the doubling time is around 8 to 10 days. That's how aggressive it is. Whereas in non-small carcinomas, you have certain subtypes like adenocarcinoma, squamous carcinoma, adenosquamous carcinoma, and salivary gland tumors. Comparatively, non-small cell carcinomas are less aggressive, but we have multiple treatment options in non-small cell carcinomas. These days we have targeted therapies. Once you collect the biopsy, you get to know which is the subtype of the cancer, and after knowing the subtype, you can do the targeted genomic testing or gene sequencing, where you get to know what is the mutation involved in this cancer, and you can treat accordingly. That is how targeted therapy comes into role. Targeted therapy, when you compare with conventional chemotherapy, they are very safe, they have less side effects, they are costly, but they have more success rate when you compare with conventional chemotherapy. So that is the reason why these days even lung cancer who was diagnosed with adenocarcinoma, especially females, non-smokers, even stage 4 cancer, they can pull on life for 10 to 15 years with only oral chemotherapy. So these days targeted therapies change the life of cancer patients. There are no hair fall, there is no associated nausea, vomiting, the side effects are very minimal. So that is the reason why we need to identify your symptoms, get the imaging first, get biopsy as fast as possible, and start the therapy at the earlier stage so that you can have a good life. Now, many times after taking a biopsy, patient becomes impatient. When are you going to start my treatment? So these days the rule is very clear. Once you get a biopsy, you need to run a immunohistochemistry to see what is the subtype of this cancer. So once you know the subtype, you can run the gene sequencing. Thereby you get to know the mutation, whether a particular targeted therapy can be given or not. So once you see these things, after taking a biopsy, for a patient to get started on therapy, it takes around 8 to 10 days. So that is how the recent cancer treatment is evolving. So as I told you, lung cancer is very dangerous. It has huge death rate. So early detection at the early stage is need of the hour. And if you are finding any symptoms like unexplainable cough, hemoptysis, coughing of blood, or chest pain or fluid in the lung, do visit a pulmonologist and get yourself checked easily. We care about you.